10 symptoms of stroke in women. Did you know that 1 in 5 women will have a stroke at some point in their life? This alarming statistic highlights the importance of understanding stroke symptoms and acting fast. Strokes are life-threatening and can lead to severe disabilities, yet many people miss the early warning signs. The good news is that by learning to recognize these symptoms, you can potentially save your life or that of a loved one. Let's explore the top 10 symptoms of stroke in women and, more importantly, how to prevent them. Before looking at the symptoms of stroke, let's understand what stroke means. A stroke occurs when blood flow to the brain is disrupted, depriving it of oxygen and nutrients. This can cause brain cells to die within minutes, leading to potentially life-threatening consequences. There are 2 main types of strokes, ischemic and hemorrhagic. Ischemic strokes, which account for about 87% of cases, happen when a blood clot blocks or narrows a blood vessel in the brain. Hemorrhagic strokes occur when a blood vessel bursts, leading to bleeding in or around the brain. Both types can cause severe damage, but they require different treatments, so quick diagnosis is crucial. So, what are the little ignored symptoms of stroke? Sudden weakness or numbness in the face or limbs. Imagine going about your day, and suddenly one side of your body feels numb or weak. It's a frightening experience, but many people, especially women, might dismiss it as fatigue, stress, or even just having slept in the wrong position. However, sudden weakness or numbness, particularly on one side of the face, arm, or leg, is one of the clearest warning signs of a stroke. Recognizing it quickly can make the difference between recovery and long-term disability. A stroke occurs when blood flow to a specific part of the brain is interrupted, cutting off its supply of oxygen and nutrients. Without these essentials, brain cells in that region begin to die, causing visible physical changes in the body. This is why numbness or weakness often appears on one side of the body. It corresponds to the side of the brain affected by the stroke. The problem is, people tend to brush off these symptoms. They might think it's nothing serious and wait for the feeling to come back. But every second counts during a stroke. The longer the brain is deprived of blood, the more damage it sustains. This is why it's critical to act immediately if you notice symptoms. To help identify a stroke, remember the acronym FAST. Face. Ask the person to smile. If one side of their face droops or doesn't move as expected, it's a red flag. Arms. Have them raise both arms. If one arm drifts downward or they can't lift it at all, it could indicate muscle weakness due to a stroke. Speech. Listen to their speech. If it's slurred, garbled, or strange, it's a clear sign something's wrong. Time. If you notice any of these signs, time is of the essence. Call emergency services immediately. Prevention is key to reducing your risk. Regular exercise, maintaining a healthy weight, managing blood pressure, and avoiding smoking are crucial steps. Eating a balanced diet rich in fruits, vegetables, and whole grains also supports vascular health. In moments of crisis, acting swiftly can save a life. Don't ignore sudden weakness or numbness. Treat it as the emergency it is. With fast thinking, you can help yourself or someone else get the care they need before it's too late. Speaking of warning signs, numbness isn't the only one that creeps in suddenly. Sometimes it's your ability to understand or express words that vanishes next. Confusion or trouble, understanding speech, sudden confusion or difficulty. Understanding speech is a symptom of stroke that's often dismissed, especially by women. Whether it's struggling to comprehend what someone is saying or being unable to form coherent sentences yourself, this issue can come on abruptly and is easy to attribute to stress, exhaustion, or even aging. Unfortunately, overlooking this symptom can delay critical treatment when every second matters. When a stroke affects the brain's language centers, specifically in areas like the Broca's or Wernicke's regions, it can disrupt your ability to process or articulate thoughts. This condition, known as aphasia, can make words feel jumbled or incomprehensible. Some describe it as their brain freezing, where familiar words suddenly seem foreign or unreachable. This symptom is not just disorienting, it's a warning sign of serious neurological damage. What makes this symptom particularly dangerous is how subtle it can appear. For instance, if the confusion is mild, a person may think they're simply tired or overwhelmed. However, even brief episodes of confusion or difficulty speaking should be treated as medical emergencies. The faster the person receives medical intervention, the greater the chance of minimizing long-term brain damage. To reduce your risk of experiencing this symptom, preventive measures are crucial. Regular health checkups help detect and manage underlying conditions like high blood pressure, diabetes, or high cholesterol, all of which are significant risk factors for strokes. A balanced diet also plays a vital role in protecting cognitive function. Incorporate brain-boosting foods such as leafy greens, nuts, fatty fish, and whole grains into your meals. These not only support overall brain health, but also improve vascular function, ensuring better blood flow to the brain. Mental exercises can also keep your brain sharp. Activities like reading, puzzles, or learning new skills stimulate your brain and may help build a cognitive reserve that protects against stroke-related damage. Pair this with stress management techniques, such as mindfulness or yoga, to maintain a calm, focused mind. While confusion and speech difficulties show how strokes can affect communication, the brain's interconnectedness means strokes often disrupt other senses as well. For instance, vision changes are another critical symptom, reminding us just how quickly and unpredictably strokes can alter our perception of the world. Let's explore how this unfolds. Vision problems in one or both eyes. What if, out of nowhere, your vision becomes blurry, you start seeing double, or you lose sight in one eye entirely? It might be tempting to brush it off as simple eye strain or fatigue, but sudden vision changes can be an alarming sign of a stroke. For women especially, this symptom is often misinterpreted or ignored, allowing precious time to slip away when immediate medical attention is critical. Vision changes during a stroke occur because the blood flow to the brain's occipital lobe or optic nerve is disrupted. This area is responsible for processing visual information, and when deprived of oxygen and nutrients, it can cause temporary or even permanent vision loss. Some people may experience blind spots, flashes of light, or complete blindness in one or both eyes. These changes can happen so quickly that it's easy to attribute them to less serious issues, such as migraines or tiredness. But ignoring sudden changes in your sight could lead to severe consequences. These symptoms don't just impact your ability to see, they're a clear signal that the brain is in distress. Even if the vision problems resolve on their own, they should be taken as a warning sign of a possible transient ischemic attack, TIA, also known as a mini-stroke, which often precedes a major stroke. Preventing these issues starts with routine eye exams. Your eye doctor can often detect early signs of underlying conditions like high blood pressure, diabetes, or even cardiovascular problems, all of which increase stroke risk. Additionally, maintaining a healthy lifestyle is crucial for protecting both your vision and brain. Include foods rich in omega-3 fatty acids, like salmon and walnuts, in your diet. Antioxidant-rich foods such as blueberries, spinach, and carrots can also help protect your eyes and promote overall vascular health. Don't forget about the importance of hydration and limiting screen time, as both contribute to overall eye strain and fatigue. Finally, managing stress and getting regular exercise improves circulation and reduces the risk of stroke-related vision problems. While vision changes are a serious warning, strokes can manifest in other ways that might feel equally sudden and overwhelming. For instance, what if the warning sign comes not through your sight, but as an excruciating headache that feels unlike anything you've ever experienced? Let's look at this next critical symptom: severe headache without a known cause. Have you ever experienced a headache so intense it feels like your head is about to burst? For women, this might be brushed off as a migraine or stress, especially if migraines are common. But there's a significant difference between the headaches we're used to and a sudden severe headache that seems to come out of nowhere. This type of headache, often described as the worst pain someone has ever felt, could be a warning sign of a hemorrhagic stroke, a life-threatening condition caused by bleeding in the brain. Hemorrhagic strokes occur when a blood vessel in the brain bursts, leading to bleeding that puts pressure on surrounding brain tissue. This can result in the sudden onset of a debilitating headache. Unlike a typical migraine, this headache often comes without warning and may be accompanied by other symptoms such as nausea, vomiting, confusion, blurred vision, or a stiff neck. It's a signal that something is critically wrong and immediate medical attention is non-negotiable. Unfortunately, many people dismiss these headaches thinking they'll pass with rest or over-the-counter pain relief. This delay can be fatal as the bleeding continues to damage brain cells and increase pressure in the skull. That's why recognizing this symptom as an emergency and seeking help immediately is so important. Prevention begins with monitoring your blood pressure regularly, as chronic high blood pressure is the leading cause of hemorrhagic strokes. High blood pressure weakens the walls of blood vessels, making them more likely to rupture. If you're managing high blood pressure, work with your doctor to keep it under control. Lifestyle changes such as reducing your intake of salty and processed foods, staying hydrated, and incorporating more potassium-rich foods like bananas, spinach, and sweet potatoes can help maintain healthy blood pressure levels. Stress management is another essential factor. Stress can spike blood pressure, so practices like meditation, deep breathing exercises, and physical activity can be life-saving. Regular exercise also strengthens your cardiovascular system, reducing stroke risk. While severe headaches are a glaring red flag, strokes don't always make their presence known so overtly. Sometimes the warning sign is subtler but equally dangerous. Dizziness or loss of balance. Experiencing sudden dizziness, loss of balance, or difficulty walking can be alarming and may indicate a stroke, particularly when accompanied by other symptoms like numbness or confusion. These issues arise when a stroke impacts the cerebellum, the brain region responsible for balance and coordination. Unfortunately, such symptoms are often dismissed as dehydration, vertigo, or simple fatigue, leading to dangerous delays in seeking medical attention. The cerebellum plays a crucial role in maintaining our equilibrium and coordinating muscle movements. When a stroke disrupts blood flow to this area, it can result in unsteadiness, a spinning sensation, or an inability to walk properly. These manifestations should never be ignored. If you or someone else experiences sudden balance issues or dizziness, it's imperative to consider it a medical emergency and seek immediate assistance. Preventing such stroke symptoms involves proactive measures to enhance balance and overall health. Engaging in activities like yoga or Tai Chi can significantly improve stability and coordination. These practices focus on controlled movements and mindfulness, which strengthen the muscles and neural pathways responsible for balance. In fact, studies have shown that Tai Chi is effective in improving balance function in stroke patients. Additionally, moderating alcohol consumption is vital. Excessive alcohol intake can lead to high blood pressure and other cardiovascular issues, increasing the risk of stroke. By limiting alcohol and maintaining a balanced diet rich in nutrients, you support vascular health and reduce the likelihood of stroke-related complications. It's also beneficial to incorporate balance exercises into your routine. Simple practices like standing on one leg, heel-to-toe walking, or using balance boards can enhance proprioception and prevent falls. Regular physical activity not only improves balance but also contributes to overall cardiovascular health, further decreasing stroke risk. While physical symptoms like dizziness and loss of balance are prominent indicators of a stroke, it's essential to recognize that strokes can present with less obvious signs as well. For instance, sudden difficulty swallowing, known as dysphagia, can also be a warning signal. Difficulty swallowing, dysphagia. Swallowing is a fundamental action we often take for granted. However, when it becomes unexpectedly challenging, it can signal a serious health issue. Difficulty swallowing, known medically as dysphagia, is a lesser-known symptom of stroke that is frequently overlooked, especially among women. This oversight can lead to severe complications if not addressed promptly. Dysphagia occurs when a stroke affects the areas of the brain responsible for controlling the muscles involved in swallowing. This disruption can result in symptoms such as coughing or choking during meals, a sensation of food being stuck in the throat, or a reluctance to eat due to discomfort. If these signs are present, it's crucial to seek medical attention immediately, as untreated dysphagia can lead to aspiration pneumonia, a life-threatening condition where food or liquids enter the lungs, and malnutrition. Preventing dysphagia involves maintaining overall vascular health to reduce stroke risk. Incorporating antioxidant-rich foods into your diet, such as berries, spinach, and nuts, can help combat inflammation and protect blood vessels. Additionally, staying well hydrated is essential, as dehydration can thicken the blood, increasing the risk of clot formation and stroke. Regular physical activity also plays a vital role in stroke prevention. Engaging in exercises that promote cardiovascular health, such as walking, swimming, or cycling, can improve blood flow and reduce the likelihood of stroke. Moreover, managing stress through relaxation techniques like meditation or deep breathing exercises can help maintain healthy blood pressure levels, further decreasing stroke risk. It's important to recognize that dysphagia often accompanies other stroke symptoms, such as facial drooping, arm weakness, or speech difficulties. Being aware of these signs and seeking prompt medical attention can significantly improve outcomes. Remember, early intervention is key to preventing severe complications associated with stroke-related dysphagia. Did you know that difficulty swallowing often comes hand in hand with another overlooked symptom? Shortness of breath or heart palpitations. Experiencing shortness of breath and irregular heartbeats can be alarming, especially when they occur without any apparent physical exertion. In women, these symptoms may indicate a stroke, as hormonal and cardiovascular differences can make them more susceptible to such signs. It's crucial to recognize that these symptoms can mimic other conditions, such as anxiety or heart attacks, leading to potential delays in seeking medical attention. When a stroke affects the brain's control over autonomic functions, it can result in symptoms like shortness of breath and irregular heartbeats. These signs should not be dismissed, as they may signal a serious underlying issue. If you experience labored breathing or a sensation of your heart skipping beats, it's imperative to seek immediate medical care. Preventive tip: incorporating regular cardiovascular exercise into your routine can significantly improve heart health and maintain the elasticity of your blood vessels, thereby reducing the risk of stroke. Activities such as brisk walking, swimming, or cycling are excellent choices. Additionally, managing stress through mindfulness exercises, deep breathing, and regular physical activity can help lower stress levels and reduce stroke risk. Recognizing and addressing these symptoms promptly can be crucial in preventing more severe complications. These cardiovascular changes can also impact your energy levels, which leads us to another critical symptom: sudden fatigue or fainting. Feeling tired after a long day of work is common, but what if you suddenly feel completely drained without any clear reason? Extreme, unexplained fatigue, especially when accompanied by other stroke symptoms, can be a sign of something far more serious. Women who experience a stroke often report feeling an overwhelming sense of exhaustion, sometimes to the point of nearly fainting. This type of fatigue is usually caused when the brain isn't receiving enough oxygen due to a blood clot or hemorrhage. The brain requires a steady supply of oxygenated blood to function properly, and when this is interrupted, it can cause fatigue that is much more intense and sudden than typical tiredness. Unfortunately, many people dismiss this as simple overwork or low blood sugar, especially when they have a lot on their plate, juggling work, family, and personal responsibilities. However, fatigue that is paired with other symptoms like weakness, confusion, or numbness should never be overlooked. If you notice any of these signs, it's important to act quickly. Don't chalk it up to just being tired. This could be a stroke in progress, and every second counts. Calling for help immediately can be the difference between a full recovery and permanent brain damage. One of the best ways to reduce the risk of stroke-related fatigue is by prioritizing sleep. Poor sleep quality, especially conditions like sleep apnea, has been linked to an increased risk of stroke, particularly in women. Aim for 7 to 8 hours of restful sleep each night to help your body recharge and to keep your cardiovascular health in check. Creating a calming bedtime routine, avoiding caffeine late in the day, and limiting screen time before bed can improve your sleep quality. As we discuss fatigue, it's important to consider how strokes can also affect mental and emotional well-being. The next symptom on our list is something that might not seem physical at all: mood changes. These shifts can also be a sign that something serious is happening inside the body, and they often go unnoticed or are misinterpreted as stress or anxiety. Sudden mood swings or behavioral changes. Have you ever felt completely fine, only to suddenly experience a shift in your emotions? 1 minute, you're calm and collected, and the next, you feel irritable, anxious, or even unusually happy. These sudden mood swings and personality changes can be subtle signs of a stroke, and they're more common than you might think. A stroke can disrupt the brain's function, especially in areas that regulate emotions. When blood flow to these regions is blocked, it can lead to dramatic changes in how you feel. Women, in particular, are more likely to experience these emotional shifts, which can easily be mistaken for hormonal fluctuations, stress, or even the pressure of daily life. For many, these mood changes may seem out of character, or they might just chalk them up to a tough day. But if these emotional swings are paired with other stroke symptoms like numbness, weakness, or confusion, it's a strong indicator that something serious is happening. If you notice sudden and unexplained emotional changes in yourself or someone else, don't ignore them. The combination of these symptoms with physical signs could be a warning that a stroke is occurring. Every minute counts in a stroke situation, and the sooner you act, the better the chances of minimizing brain damage. Prioritizing mental health is just as important as taking care of your physical health. Engage in activities that support emotional well-being, such as journaling, meditation, or talking to a therapist. These practices can help you keep a clear sense of balance and make it easier to recognize when something doesn't feel right. As we discuss the mind's role in stroke symptoms, it's important to understand how strokes also affect our ability to move and respond physically. Another critical sign of stroke is sudden weakness or paralysis, especially on one side of the body, which we'll explore next. Each of these symptoms, whether physical, emotional, or neurological, serves as a warning sign that something is seriously wrong. Strokes don't wait, and neither should you. Acting quickly can mean the difference between recovery and lasting damage. Now that you know the signs and preventive measures, share this knowledge with others. You never know whose life you might save. Stay informed, stay prepared, and stay healthy. If you like this video, don't forget to hit that like button, subscribe for more health tips, and leave a comment below with any questions or thoughts you have. Share this video with your friends and family because everyone deserves to know the signs of a stroke.